When it comes to your hearing, who treats your ears matters. At Hearing First Surbiton, every appointment is carried out by a fully qualified audiologist, not general staff, and not ENT-trained assistants. Audiologists specialize specifically in hearing and ear health. Their training focuses on the delicate structures of the ear, how hearing works, and how conditions like earwax buildup, tinnitus, and hearing loss should be properly managed. This level of expertise ensures every patient receives safe, informed, and professional care. Some clinics rely on staff with limited ENT training or non-specialist backgrounds. While ENT training is valuable in hospital settings, it doesn't always equate to specialist earwax removal expertise. Hearing First Surbiton takes a different approach by ensuring all procedures are performed by audiologists whose daily focus is ear health. This expertise is especially important during microsuction earwax removal. The audiologist can visually assess the ear canal in real time, identify underlying issues, and adapt the procedure based on your specific ear anatomy. This reduces risk and improves comfort compared to older methods such as syringing. Choosing audiologist-led care also means better advice. Whether you're experiencing recurring blockages, tinnitus, or age-related hearing changes, an audiologist can provide guidance tailored to your long-term ear health, not just a quick fix. At Hearing First Surbiton, patient safety and quality care come first. By hiring only audiologists, the clinic ensures consistency, professionalism, and peace of mind for every patient who walks through the door. Your ears are delicate. Trust them to professionals who specialize in hearing every single day.